My supervisor assigned me 18 patient visits in an 8-hour shift. That's impossible, Mrs. Crane. Each visit requires at least 30 minutes. That's 9 hours of care plus driving. Figure it out, Xavier. The schedule is the schedule. So I worked unpaid overtime every day, 12 hours to complete an 8-hour schedule. Then I noticed something strange on my timesheet. 23 visits logged for Tuesday. I only made 18. Mrs. Crane, there's an error. It shows I visited 5 patients I've never met. Clerical mistake. I'll fix it. But next week, the same thing. Extra visits logged. Patients I never saw. Addresses I never visited. I kept copies. Documented every discrepancy. Over 1 month, my timesheet showed 147 visits. I actually made 94. 53 phantom visits logged under my name. I contacted other aides quietly. My logs show 12 visits Thursday. I only did 8. They have me visiting a patient in Riverside. I've never been to Riverside. Someone named Margaret Chen is on my sheet every week. I don't know who that is. 8 aides. All with phantom visits. All billing Medicare for services never provided. 53 phantom visits per month at $175 average equaled $9,275. 8 aides with similar patterns meant nearly $900,000 per year in fraudulent billing. I searched the phantom patient names. Margaret Chen, Robert Williams, Dorothy Palmer. I found obituaries. 3 of them died over a year ago. Mrs. Crane was billing Medicare for visits to dead patients. I took everything to a Medicare fraud attorney. He pulled my phone's GPS history. I was home when I supposedly visited Margaret Chen. I was at the grocery store when I supposedly treated Robert Williams. The FBI subpoenaed billing records, interviewed patients' families, checked death certificates against visit logs. Mrs. Crane submitted 4,147 fraudulent claims over 3 years. She billed for visits to 23 deceased patients, some for over 2 years after their deaths. Total stolen from Medicare, $847,000. Meanwhile, real patients received rushed, inadequate care because aides were stretched impossibly thin. I asked the agent if I could be there when they arrested her. That's unusual. She put 53 phantom visits on my timesheet in 1 month. Used my name to bill Medicare for patients I never saw. I need to see this end. They agreed. The agency office. Mrs. Crane was at her desk when FBI agents walked in. She saw the badges, then saw me. Xavier, what is this? I held up my timesheets. 23 visits logged for Tuesday. I made 18. 53 phantom visits in 1 month under my name. Her face went pale. Grace Crane, you're under arrest for federal healthcare fraud. This is a misunderstanding. Billing errors happen in healthcare. Margaret Chen, I held up the obituary. You billed Medicare for visits to her every week. She died 14 months ago. They cuffed her at her desk. Robert Williams, Dorothy Palmer, 23. Deceased patients. Some billed for over 2 years after their deaths. The other aides were watching from their desks. The people she'd overworked to cover her phantom billing. You assigned me 18 visits in an 8-hour shift. Impossible schedule. I worked 12 hours unpaid every day. I was managing resources. You were stretching us thin so you could bill for imaginary visits. I held up the FBI report. 4,847 fraudulent claims. $847,000 stolen. Mr. Henderson's daughter was waiting in the hallway. I'd called her. Mrs. Crane saw her. Saw the photo she was holding. My father developed bed sores because Xavier couldn't spend enough time repositioning him, she said quietly. Your schedule didn't allow it. That's not my... Mrs. Okonkwo missed her medications because aides were racing to the next appointment. She ended up hospitalized. They pulled Mrs. Crane toward the door. Real patients hurt, I said. Real people suffering, so you could bill for imaginary ones. She stared at the floor. 8 aides, all with phantom visits on their sheets, all working impossible schedules while you submitted claims for patients who were dead. They walked her past the staff, past the aides she'd overworked, past the schedules that never made sense. You told me to figure it out when I said 18 visits was impossible. You knew it was impossible. You counted on us being too scared to question it. She had nothing to say. Mr. Henderson's daughter followed us to the parking lot. Mrs. Crane saw her one more time before they pushed her into the car. His bed sores went to the bone, the daughter said. While you billed Medicare for patients who didn't exist? The car door closed. I looked at my timesheet. 53 visits I never made. Dead patients treated on paper. You told me billing errors happen in healthcare. I watched the car pull away. This wasn't an error.